you get sick, do you reach for the echinacea? Or maybe you take echinacea every day to keep yourself from getting sick. Is that you? Write in the comments if it is you. And by the way, it's okay if it is you. A lot of people take echinacea because oftentimes we feel it may help prevent or treat a cold. A lot of people will also take it to boost the immune system. But the question is, does it really do these things? Well, you're in luck. I'm here. I'm Dr. Jen. I'm going to tell you the information and the data that we have up to this point about whether echinacea really sort of lives up to the hype. Echinacea, the species, it's really commonly referred to as coneflowers, which is a group of Native American wildflowers from the daisy family. And I have to tell you, I actually really love daisies. I remember, like, it was in You Got Mail, that movie with Meg Ryan, when she's sick, she's brought daisies, and she's like, I love daisies. They're like my favorite flower.
Don't you think that daisies are the friendliest flower?
Anyway, I love daisies too. Sorry, like, I love that movie You Got Mail. Back to the echinacea. Okay, it's indigenous to North America. It was used by Native Americans of the Great Plains, and we know that echinacea has been around like literally forever. Like, we're talking hundreds of years. Okay, the Native Americans have often used echinacea both topically, that means on top of the skin, or by mouth for things like burns, bites, cough, cold, sore throat, you name it. Okay. As I mentioned, echinacea is generally used nowadays. We use it for treating or preventing like the common cold, upper respiratory tract infections, and things like that. And this is according to Up to Date. They say that in 2012, echinacea was the 6th most common non-vitamin, non-mineral supplement used by adults in the United States. It was used by 2.3 million adults. So I imagine many of you are echinacea takers out there. Let's get to the nitty-gritty, my friends. Does it work? Does it do what it's supposed to do? Well, according to the NIH, and I feel like I need a drum roll here, but according to the NIH, and by the way, it's not all bad, the NIH says that taking echinacea may slightly reduce your chances of catching a cold. They say it's still unclear whether echinacea can shorten the length of a cold. We need more research to confirm these findings. So, it's actually not so bad. I mean, oftentimes, and I'm going to say that here, we don't have enough data. We don't have enough research. That still applies here. We need better studies, better powered studies, blah, blah, blah. We need more conclusive data. That still applies here. But according to the NIH and other sources, taking echinacea may slightly reduce the chances of catching a cold. Now, there's a couple of caveats and things you must remember when it comes to echinacea and basically any other sort of herbal supplement, etc. These are not tightly regulated by the Food and Drug Administration. Okay, that sort of brings in some inherent variables. We know that these supplements are not always well studied. Sometimes we don't know exactly what's in the bottle of a supplement, right, in terms of what's on the label versus what's actually in the bottle. Along with the lack of regulation, we don't have a lot of studies. What I'm trying to tell you is that it's a little bit of the wild, wild west when it comes to supplements. But this is not the first time you've ever heard me say this. You know I say this all the time because it's true, and I have to remind us of that. So these are some of like the what I will say, and I know you're going to be happy with this, as am I. If echinacea is something that you'd like to take, I would say for many people, it's probably safe to do so. However, I am not your doctor. You got to talk to your doctor about if it's right, okay? So even though we don't have all the data in the world and it may slightly reduce your chances of catching a cold, but we don't have much more information, it's something you feel very strongly about, talk to your doctor and see if they're okay with you trying it, okay? As I'm Dr. Jen, please subscribe to my channel on YouTube. Please follow me on Facebook, Instagram, TikTok, LinkedIn, all the good stuff. And please sign up for my free weekly health newsletter at my website, drjencaudle.com, because I love you. Bye.